Welcome to Heart with Dr. Nieca. And today we're going to be talking about an organ that's close to the heart, the lungs. And joining me on Heart to Heart today is Bonnie Addario. Bonnie is the author of the brand new book, The Living Room, a lung cancer community of courage. And I want to tell you a little bit about Bonnie. She's co-founder and board chair and patient advocate of GO2 Foundation for lung cancer, as well as an educator. She has empowered patients and given them a voice since receiving a stage 3B lung cancer diagnosis almost 2 decades ago. Recognizing the need for education, empowerment, advocacy, and research to help patients and family, Ms. Addario and her family founded the Bonnie Addario Lung Cancer Foundation in 2006. In 2019, the ALCF, abbreviated of the Bonnie Addario Lung Cancer Foundation, and Lung Cancer Alliance merged, forming GO2 Foundation for Lung Cancer. Ms. Addario is an advisor to industry leaders, clinicians, policymakers, and is a member of the Personalized Medicine Coalition Board. In 2020, she received the Lifetime Achievement Award from Cure Magazine. It's so great to have you joining me today, Bonnie.
Thank you. I'm absolutely thrilled to be here. You know, I'm always thrilled to speak about lung cancer wherever and whenever I can. We have a lot of work to do.
I know. And what's very interesting is there's been a flurry of research recently citing the fact that lung cancer is increasing amongst women.
Right.
And in fact, a lot of those cancers, most people think of lung cancer as being that cigarette smoking is the cause of lung cancer. But people don't realize that many of the cancers we're picking up now have nothing to do with cigarette smoking.
Right, exactly.
And the challenge, and I know you're a very big advocate for research and supporter of research, is that many of our screening programs don't target those people at risk who have the non-smoking related lung cancers.
Right. They, very often when they get the symptoms, which are lung cancer symptoms, which is shortness of breath and coughing, etc. They go to their personal physician and they give them an X-ray, which is really the worst thing possible because tumors can hide behind the lungs and hide behind the heart and the ribs. We need a CT scan, but too often the patient is just put on antibiotics over and over and over again.
Thinking they have a pulmonary infection.
Exactly. And then when some event or another happens, like pneumonia or pleural effusion, etc., that's when they get diagnosed. And normally, they're already stage 4 by now.
That's right. And I want to talk about your story a little bit because I found it interesting when you were having these symptoms. One of the things that we always talk about in a screening cardiovascular disease in women is that they're underscreened. And I think the doctor actually started screening you for heart disease.
Exactly. And then neurological, then
right. I know where that came in. Yeah.
Right. And I don't even want to tell you what he prescribed. I was on Vioxx for the longest time. And
wow.
That's an anti-inflammatory and it actually
don't prescribe anymore.
Yeah, exactly. They took it off the market, thank God, because then they started looking elsewhere. But because it's an anti-inflammatory, the tumor I had was on my heart and on my aorta, and it was like pumping. And I didn't really have pain, but I had this like thumping going. Yeah, but the Vioxx actually helped it, So anyway, yeah.
That's really interesting. So tell us, our viewers today who have not yet read the book, I
Right,
wanted to talk a little bit about, about what you're a professional woman, you were running an oil company.
right.
That's quite amazing.
Yeah,
And
yeah.
what happened? You just started not feeling well, or?
Exactly. I just started, short of breath and this pumping feeling in my chest. And I couldn't get really anyone to pay attention to me or solve the problem. And my husband said, "You and I are going to go get a full body scan. That's it. We're going to take this into our own hands." We both got full body scans, and the radiation person said to me, he said, "Bonnie, you see this right here, this black thing?" He said, "Take this to your doctor today. I want you to leave here and go to your doctor today because this is a bad problem."
Right, and then you were referred to eventually a lung specialist, right?
Correct, correct, correct.
And there is
Finally,
it finally, and
right,
here's why I think highlights the benefits of getting a second opinion,
correct.
right?
Absolutely.
So talk about that.
Well, the first doctor I saw was not a cancer, a surgeon. It was a surgeon they sent me to, and he wasn't a lung cancer specialist. And that just didn't sound right to me. And the good news was he was on vacation. So I was on the board of directors, the foundation board for a small community hospital, close to our home. And I came home from work one night and I was reading the local newspaper. There was this little postage stamp article in there about a lung cancer surgeon that was coming down from UCSF to Sequoia Hospital to do lung surgery. And, by now in my own head, I knew I had lung cancer, because all of the research I did on my own pointed right to that. So I called the lady that ran the foundation and I said, "I need to see this Melissa Lim person." She was the pulmonologist that was heading up this
Okay.
lung program. So David Jablons was the doctor from UCSF. They put me in touch with all of them, and it still took a while to get things figured out. But I finally had a second biopsy at UCSF, which was very professional, with a doctor, a nurse, a pathologist in the
Right.
room, completely different than anything I experienced thus far. And they said, "You have lung cancer." And then they put together they had a multidisciplinary team, which I highly recommend, for any patient, for any cancer.
So explain what that means, the multidisciplinary.
Okay. A multidisciplinary team is a radiation oncologist, an oncologist, a pulmonary doctor. I already said rad onc. Anybody involved in the lung cancer diagnosis and the people that are going to be involved along the way. So what you end up getting is 10 eyes or 12 eyes or
Right.
14 eyes on your very personal diagnosis. And so you get all of these expert opinions all at one time. And then they come to agreement that, this is where we need to go. And I know it made me feel very confident that finally I had found the right people.
That's right. And the challenging thing was they were concerned about doing the surgery because the lung tumor was so close to your heart and the
Exactly.
aorta.
Exactly. So we all agreed that I would have some pretty rigid chemotherapy. I had chemotherapy every Friday, carboplatin, Taxol,
Wow.
which they don't even put together anymore. It's rare that they do that, but they knew they had to work fast. So, and then I had radiation every day, Monday through Friday, um, um, and then chemotherapy on Friday for about 9 weeks. And the goal was to move this tumor enough away from the aorta where we could possibly have a successful surgery.
The
And
chemotherapy and the radiotherapy given to shrink the tumor.
correct. It wasn't done to be curative. It was done to allow me to possibly have surgery along the way. So I did have the surgery, and there were 3 surgeons, thoracic surgeon, heart surgeon, and vascular. And they all took their turn, with me. My poor family was, out in the hallway in the waiting room, and a different doctor came out every so often. But the bottom line is, I knew I had the best care possible. And I made myself a promise that if I got through this knothole,
Right.
to the other side, I would do something about the way lung cancer was treated
Right.
and
And
the stigma.
I want to talk about the living room and let everyone know I'm going to hold up the book.
Okay, great. Thank you. Thank you.
The living room proceeds from the book are going to benefit research and patient services.
I'm not taking a dime, not a dime.
I mean, I think this is a book that will benefit lots of
Absolutely.
people, not only
Absolutely.
what's reading it.
And
Tell us about the living room and what is the
okay.
concept of the living room, and then talk about the book.
Okay. Well, a long time ago, I was asked by a big academic center to come in and speak to their support group. So I said, sure, I was honored to do it. And I show up down there and I see this gray room, this gray oblong table, gray chairs, no windows. And I see this group of people in there. And I was immediately struck thinking, there's no hope in this room. There is no hope in this room. These people have come here to die, and it was a social worker that was leading the support group. It wasn't a physician or, a doctor or anything that they could really learn to do something different with their cancer. So I went back to work and I told our team, I said, you're gonna kill me, but we're gonna start a support group. And they did. They all gave me the eye roll, like, here she goes again.
So you've learned something about medicine. Whenever you have a new idea that's out of the box and out of the mainstream, everybody rolls their eyes.
Exactly. So, we moved ahead and did it. And we called it the living room. And it has all these beautiful sofas. And, it's really warm and welcoming. And there's these big letters that say hope on the wall. We have food, we have wine, we have water, and we always bring in a thought leader to talk to the patients. Also, patients can dial in from anywhere in the world and ask the speaker a question. So it became so popular, people literally were outside and there wasn't enough room to fit everybody in this particular room. So there was this girl that worked for us who loved to do political interviews at night. And she said, well, here's what we'll do. We'll bring the local TV station in here. Wow. We'll live stream the whole thing around the world. Everybody will be able to see it.
Wow.
And sure enough, we did it. And we've reached 143 countries.
That's great. And now you have social media. So
exactly.
24/7.
Exactly. There's no excuse for any lung cancer patient not to be educated, and learn what they need to do about their cancer. It's out there. We have it. It's done. I had a girl call into our office from Prague, and she wanted to talk to me. And of course, I got on the phone and she said, I want my mom to have a second opinion. Wow. Which you just spoke about, a few minutes ago. And she said, can you help me? And I said, give me your name, your number, everything. Tell me about your mom, blah, blah, blah. So I did. And I called the International Association for the Study of Lung Cancer. And I said, Fred, I was talking to Fred Hirsch at the time. I said, Fred, who have we got in Prague? He said, we've got Dr. Rafal. He's a great guy. He used to be my fellow. Wow. So I emailed Dr. Rafal and I said, Dr. Rafal, you probably have no idea who I am, but here's what I'm looking for. He said, Bonnie, I do know who you are. And here's my cell phone number. Give it to this young lady and I will be happy to help her mother. Prague.
That's great. You see, that's what you need to do. You really, it's like not only about advocating for yourself, but also finding those key people who can help you advocate for your health.
Yeah. And they're always willing. Nobody has ever really told me no. When I ask them to do something outside the box, so
it's, and once something develops momentum, then the ones who were rolling their eyes join like it was their idea.
And they do, and I'm fine if they say it's
I'm
their
fine
idea. You know, it's
too.
a-okay.
In the end, in the healthcare business, eventually it's going to help someone.
Exactly. Exactly. I actually hear people tell me things that I said 5 years ago, you know, and they go, well, you know, blah, blah, blah. And I'm going, really? Oh, well, that's interesting. You know, just,
That's
yeah,
very
it's
good.
great. It's
So
great.
how did you get started on the book, The Living Room? And tell us about that.
Same reason, you know, and really from our own living room, um, I just knew that the general public, because there's a huge stigma around lung cancer, and that the only people that get it are people that smoke, which we all know, well, we all in the medical world now know is not true. That anyone living and breathing can get lung cancer. And even young people, even very young people. We've done 2 studies for young people on lung cancer. I just thought this, you know, we've got to hit this. We've got to hit it. We've got to hit it, and we've got to hit it hard. We have to all come together, and we have to do this.
What do
And I
you
thought,
what do you see as some of the impediments in researching lung cancer? What have you learned? You know,
well,
because you come from the business world, and I'm sure from the business world, when you get into the business world of medicine, you find it pretty inefficient.
absolutely, absolutely. But the biggest negative I find, and I'm going to put NCI under the bus right now. You know, NCI, their research, for every $3,000 they do for research for lung cancer, the next breast cancer gets 43,000. You know, and it's directly related to the survival. God bless people with breast cancer. They have a chance at living. They have a chance at life. They're 90% survival. You know, this is inexcusable. The NCI, you know, has the same negative feeling toward lung cancer and pancreatic. Those 2 cancers get the least amount of research.
You know, it's interesting with a lot of the imaging we're doing for other medical issues, we're picking up these issues. And so,
Exactly.
I'll share a story. A woman came in to see me who's relatively young. She was in her late 40s, and she had a family history of heart disease, and she wanted to learn more about her risk. So one of the easiest things we can do is to do a cardiac calcium score to look for the plaque measurement of the coronary arteries. And
Sure.
she went, and they noticed, and you know, oftentimes with these studies, you have other findings.
Right.
You know, in one patient, it'll be something totally benign and just an interesting fact, but in others, there can be what they call a suspicious nodule. Suspicious
Exactly.
nodule means it could be cancer, maybe it's not, but it needs further evaluation.
Right.
I remember telling her the good news is that the calcium score is 0, but we have to do some further evaluation.
Yep.
And eventually, it came to the point when this nodule was biopsied, and we picked up an early lung cancer.
And those are the days that I absolutely love. And we do a lot of that too, when we call them incidental findings. You know, you're actually doing a CT scan for lung cancer. Good news, we don't see any masses. Bad news, where your arteries are about ready to pop. You know, let's go down that other aisle. We can find other things on CT scans as well. I would love to have a partnership with the heart people that we actually look for both and take care of both.
You know, it's interesting that you bring that up, because a colleague of mine who's an oncologist who focuses on lung cancer, Dr. Abraham Chichua,
Uh-huh.
organized, because he and I had a discussion that we can actually help pick up the people who have lung cancer that's being undiagnosed, and they can help pick up the people with undiagnosed heart disease.
Right.
And we had a conversation with one of our radiologists at NYU. And then a few weeks ago, we had a conference call with a few
Okay.
more of my colleagues in cardiology and the radiologists. And we're going to begin to look at that.
Well, I'm in. Call me. I'm all in, because when you think about it, what an amazing opportunity it is. And I have several patients in the book. I have this one little girl, Taylor, who was in a car accident, ended up in the emergency room. They're looking for, making sure that they can rule out any kind of, internal injuries. Lung cancer. They found lung cancer on this I think she was 22 or 21 at the time. And she's still with us here today. So it makes so much sense. So much sense.
Yeah, so I also want to let our viewers know today that the living room also shares stories of other lung cancer survivors, but in particular, I wanted you to talk about someone who was Matt, who was only 24 years old.
That's his name. Yeah. Yeah. He's a rock star. He's an absolute rock star. And he's been with us, almost since his diagnosis. He was very young, again, not what people think, not what physicians think someone looks like that has lung cancer. But he and his mom have taken the job on to not only help fund research, but to identify clinical trials and things as Matt has progressed along the way. And he is a living, what's the word I'm looking for? He's a living, help me here. He's,
Obviously,
example of what you can do to advocate for yourself. You can't just leave it up to other people hoping that they're all doing the right things. You must advocate for yourself.
Can you share with us what your favorite part of the book is?
Oh, what's my favorite part of the book? Well, one of my favorite people is Hank Basket, the big hug. I just love that man. I absolutely love that man. And he's such an amazing human being. He's worked with all of these children, for years and what have you. But, I have to say that each and every one of them, I chose them very purposefully for them to be very unique and different. Each one of them is unique. Each one is different. They have a different story. They have a different treatment program. But I think when you're finished reading the book, you realize that this is a very real disease that we can do something about.
So what particular aspect of the lung cancer treatments now, or the research that's going on, do you find exciting?
Oh, well, the targeted markers.
Talk about that, because that's what is known as personalized medicine.
Exactly. And personalized medicine, lung cancer really is leading the way in personalized medicine. And you're a physician, so you know what that means to identify these markers. And before you start treatment on these patients, make sure you know exactly what is driving the cancer, so you put the patient on the best possible clinical trial or treatment program that's for them based on their genomics, their genomic profiling.
How do they do the genetic testing?
It's either they either take the tissue from your biopsy and send that off. Some of the major hospitals do it in hand, but most of the communities send it off to places like Foundation Medicine, Guardant. It can also be done in blood. They use the blood more often than not when they see progression.
Sure.
To manage the cancer.
Manage the treatment.
Exactly. But that started with the EGFR mutation back in 2004.
Wow.
That was the first mutation. And now we have 9 that are working, and they have a treatment identified for that particular marker. And there's more. There's going to be more and more and more. And lung cancer finally is leading the way on drivers for all the cancers.
Realize that now we have, even people can take oral medication for some
Absolutely.
cancer.
Absolutely. And they can keep doing it. Um, and the other exciting thing obviously is immunotherapy. Um, also very exciting. And actually bringing back chemotherapy, which very often patients are afraid of, that it's going to be too invasive and painful and all of those things. But now chemo is turning out to be a great drug to boost the immunotherapy, and make that work better. So, I mean, and then the other really exciting thing is, thank you, FDA, for approving these drugs much faster than ever in the past. So we're doing the research, we're finding the drugs, and we're able to get them to the patients much faster.
So tell us a little bit about the GO2 Foundation.
Okay, well, the GO2 Foundation was very different than ours. They do a lot of regulatory business. They do a lot of screening, early detection. And we did a lot of research, on our own, funding research, doing research. We did the patient services. We were really a great marriage. I didn't want to go out and start doing regulatory things because I didn't want to stop us from doing the things we were doing, and vice versa. So it really, 2 + 2 = 10.
That's right.
Yeah.
And what, are you working on any new projects now?
Well, we're working on one of the newest. Well, we're working on two. We're working on doing a lot of research in identifying and looking deeply into small cell lung cancer,
Right.
which is a seriously underserved cancer, and KRAS. But we're also very interested in the young people with lung cancer under 40, and we've got we're doing an epidemiology study right now on these young people, and we're taking blood as well as them filling out this epi study of about 250 questions. And, we're looking to see how hormones are affecting this population and various different things.
That's really important because
Yeah.
we need to learn about, there are things that are in the environment of someone's body versus
Right.
The external environment
Right.
that can lead
Right.
to these diseases. And
Exactly.
I think it would be great to work on the project of diagnosing heart and lung disease at
Yeah,
this,
exactly. Yes, exactly.
because
It's
now, because they're both important issues in women.
huge,
Huge.
huge, huge. Yeah, I totally agree.
I want to make sure that everyone knows that the book, The Living Room, is out. It's just out, right?
It's out on Tuesday of next week.
Day of
But
next
you can
week.
order it now on Amazon, and it'll be delivered to you right away.
And I think the really important thing is that the book is going to help people learn how to advocate for themselves by sharing the stories of
Yeah.
others who made that journey already, as
Exactly.
well as helping benefit research and patient services.
Exactly.
I-
And they're going to know they're not the only ones, and that there are teams and teams and teams of people now that want to help them and really seriously increase the survival rate of lung cancer.
And now you can have the support group with the increase in the use of telemedicine during the pandemic. You can go to
Absolutely.
living rooms all over the world.
Exactly. And we actually did. We had a virologist working for us, and we turned the living room into, for several months, updates on COVID for lung cancer patients, because they're both respiratory diseases, right? So we did that exclusively for several months, and the patients loved it because we were giving them information that they weren't really getting.
And the importance of publicizing vaccines.
Exactly. Yeah.
Because people in the lung cancer group or lung disease group or people who were prioritized for vaccination.
Exactly. And actually, lung cancer should have been at the top of the list because they're both respiratory diseases.
Exactly.
And, in my case, I only have half a lung. If I had somehow contacted COVID and was on a respiratory, there's no way I would have made it. It would have been impossible to breathe.
Yeah, so we obviously being a doctor, I was in the first group of vaccination, and that's the one thing I tell all my patients. I
Yeah,
had it, and I'm here to take care of you.
that's right. Exactly. And doctors should have been the first people, without a doubt. We know, oh my God, the heroes that have come out of COVID and the cooperation amongst healthcare people and the patients' families has been unheard of before.
And at NYU, at the early times, we had been prioritizing our patients at the cancer center.
Yeah, exactly.
Well,
And all the silver linings we picked up through COVID, including telemedicine and going to patients' homes and drawing blood with a phlebotomist, so they could keep up with their treatment and without having to go into the hospital. So, so many good things we've learned from this that we can put into place.
And move them forward.
Exactly.
So Bonnie J. Addario, I want to thank you so much for joining us. And the book is The Living Room, A Lung Cancer Community of Courage. I want everyone out there to read this. This is so inspiring. Thank you.
Thank you for all you do. And you will continue to do. And I'm hoping to hear from you about heart-lung testing.
Okay.
Okay, great.
Thank you very much for joining us.